Welcome to the HealthManagement.org Digicom, Health and the City. Our Exec Editor-in-Chief and Hospital Administrator at Coimbra University, Alexandre Lourenço, will moderate the session. Our panelists include Nimish Biloria, Associate Professor, University of Technology, Sydney. Simona Agger Ganassi, Member of the Council of Healthcare Without Harm, Europe. Nino Giguashvili, Research Manager, IDC Health Insights. Diane Whitehouse, EHTEL Principal eHealth Policy Consultant. And Raju Narayan, Senior Healthcare Specialist at International Finance Corporation. Let us now welcome the moderator of today's DigiConf, Alexandre Lourenço.
Hi, good afternoon. I'm joining this session from Coimbra, Portugal, and I will be the moderator for this amazing panel. Today we will be discussing health and the city, the pandemic, climate change, and building smart cities. And we have an amazing panel of experts to discuss this very interesting topic. We live in unprecedented times. The world is facing two key challenges, the pandemic and climate change. Along with this, population aging and urbanization are two significant trends shaping this century. How can healthcare systems better operate in broader urban contexts? How can the concept of healthy cities be realized? How collaboration and integration among different entities improve? Join our panel of experts on this discussion about the impact of the pandemic, the challenge of climate change, and the goal of building smart cities and providing care beyond hospital halls. You can at all moments use our chat box and use it for comments, remarks, and making some questions to our panelists that will respond after their brief initial intervention. So today we have this amazing group of experts, Nimish Biloria, Simona Agger Ganassi, Nino Giguashvili, Diane Whitehouse, Raju Narayan, a little bit across Europe and even from Australia. So let's start with the final or the initial introduction from Nimish Biloria. Thank you so much for being with us. You are an associate professor at the University of Technology of Sydney, Australia. I know that you are under some caffeine to be with us. The floor is yours.
Thank you. So I'll just share my screen quickly. So thanks a lot. It's a pleasure being in this panel, especially considering my background. I'm also an architect and a transdisciplinary innovator who's been actually working in the area of urban health and well-being. And yes, from Sydney, still under lockdown, very sleepy. But I hope the presentation won't make you actually feel sleepy as much. So I always like to start with this particular slide, which is actually an installation which literally sort of maps out what I also do in my real life. It is connected with the idea of how space itself and the idea of compression and expansion of space can be related with the manner in which we can actually control our breathing patterns itself in real time. So this was something which is like a transdisciplinary take on how architecture, technology, as well as health can actually come together at one point. But for today's discussion, actually, I was literally very intrigued by the 80-20 sort of rule, which in this context, actually the 80-20 rule is interpreted from the perspective of the social versus the clinical determinants of health itself. And for me, actually, the 80% of it, which is connected with the social sort of determinants of health, are actually extremely vital, also coming from my interdisciplinary background. And it is vital also because the social determinants are critically connected with spatial characteristics and spatial affordances, actually, which indicate how we actually live and how our health and well-being is actually impacted. Why it's critically important is also because of this exponential growth, actually, that we see in the development of megacities. Right from the 1950s, where we only had about 2 megacities, the population of 10 million, to an estimated of 43 megacities by the time we reach 2030 itself. But unfortunately, there is a problem. The problem is actually that we are creating cities of extremes. We are creating cities which are actually fueled by this massive hunt for expansion, but at the same time, we actually stay literally a little bit reserved in terms of bringing about social equity, economic equity, and things, which actually have direct implications, which is also reflected actually by the World Economic Forum as well. I mean, it was quite astounding to actually see that even household incomes actually, and the place where you live, of course, we all know that these are directly connected. Like my affordability and where I live is actually connected with the kinds of surroundings that I would get, the kind of spatial characteristics I would be living in, the prevalence of green spaces or blue spaces around me, etc., all deprived, etc. So, I mean, these are all sort of influences which directly impact our way of living and ultimately actually start impacting our health directly or indirectly. Mental health, as we all know, also during the time of the pandemic, actually we have witnessed this quite a lot. Literally right from social determinants like demographics, education, racial segregation, etc., to the environmental determinants of noise, smell, pollution, sight, density, city communities. In some ways or the other, they're all literally connected with the built fabric itself. How we live, how we operate, how we move, and actually what does the space try to actually communicate with you in reality is something which is of big concern to how health is impacted. I mean, some of these are also outlined in this particular slide. For instance, air pollution is directly connected with pneumonia, heart attack, stroke, chronic respiratory diseases. Noise levels are also connected with cardiovascular diseases, hypertension, social isolation, again connected with mental health, blood pressure. And these actually in some way or the other are directly connected with the way we live and the environment within which we actually live. So this is something which actually is directly impacting also the manner in which the culture of our work, the culture of our life, they are all sort of influenced by the built environment. But all is not lost, actually. You can also see a slight evolution in the manner in which smart cities have actually started developing as well. So I usually term them as Smart City 1.0, 2.0 to 3.0, where we see a slight move from a technology-centric vision where big multinational corporates want to sell the technology to a much more human-centric kind of a vision now within which citizens, governments, and sort of technological constructs want to come together and sort of create the city itself. And it's an extremely interesting way to actually look at a parallel in terms of how well-being and its generations actually have also progressed. So now the shift is actually moving more towards context-based well-being, where quality of life is dependent on holistic contextual understanding of actually where we live. So these two actually do sort of complement each other, based on which that an entire vision on what empathic environments, or actually a research umbrella, which I'm currently sort of driving as well, is derived, within which the city is actually then becoming an ecology in its own right, where we're trying to understand the interaction between people, context, technology, and economics. And at the intersections of these, actually start understanding what does it mean to become a space to become desirable? Why do we value space? What is the viability of technology embedded within actually space? And how does space actually become equitable from a social context itself, which is in some ways or the other directly connected with the sustainability cities and communities goal of the SDGs itself. What is important actually within this vision is to actually now sort of move a little bit away from this notion of this siloed nature of accumulating data sets over data sets, but actually start thinking about this linked kind of a data situation, where we're trying to understand the interconnections of all the components which make up the built environment, and therefore that impacts actually on health and well-being. And that actually creates this kind of an ecology of interdependent relationships between multiple components that make up the city. So what's important is actually, again, also coming back to even the focus in my paper, actually, which you can read in the journal itself, but transdisciplinarity and co-creation actually become very, very key criteria within this entire gamut of even the empathic environment scenario itself. And why it's important is actually because at different points, we will actually be interfacing with different kinds of expertise and technologies, and we need to sort of work together. We need to come together in order to fight this bigger issues of, let's say in this case, the big issue of urban heat as well as air quality itself. How can biophilia, as well as the enhancement of public space by means of adding more green, a simple task, an analog kind of a task, but still how can it impact actually, let's say, how can it create restorative environments? How can it result in shade provision plus increase in creativity? How can it result in decreased post-operative recovery? I mean, these phenomena have actually been noticed and actually have been observed also within clinical health situations as well. So these are some things which are really critical. But again, they again go back and loop back into the manner in which the cities are actually planned, how urban transportations would actually work, how do we reduce pollution, how do we encourage active mobility. So again, in some way or the other, we're sort of creating that loop and getting back into talking to each other, talking to different disciplines so that we can actually come together. Right, so I mean, University of Berkeley actually had been doing some very interesting experiments here as well, like very simple things that we just take for granted. For instance, pavements, they literally constitute 35 to 50% of surface area in cities. And these are massive emitters actually of heat itself. And these, again, in turn start impacting our walkability sort of rates, even our desire to become actively sort of mobile within the urban environment. So simple things like even introducing like variations in color, looking at cool roofs, looking at parking lots that can sort of incorporate cool pavements that have actually proven to reduce the amount of sort of heat that is generated by almost 35 to 50%. So simple analog technologies that can actually help and aid us in becoming much more walkable and much more active within our urban environment. Similarly, like looking at other scenarios, let's say this whole idea of becoming participatory and actually then working with combined technologies. In this case, let's say embedded robotics and a simple system like you have your robotic sort of bots that are cleaning your homes. How can that kind of a self-assembly system, which is then sort of programmed by us as humans, say, I would like to have a space where kids can play. I would like to have a place where I can actually dine, or I would like to have a restorative space. How can this actually be activated in urban environments, which are literally still unused, or even at a temporary basis can actually be sort of restored and then actually moved as and where. And again, like from the COVID context, I think these become really critical scenarios where new modes of engagements can actually be generated. Again, looking at simple things like, let's say, how is it possible that we can work with activity-based scenarios to create sort of new environments of interiors, etc., that can be activated as and when required in order to maximize space. I mean, this is something that we have seen in the past as well, and also during COVID, like because of this minimal space within which we operate, I think this has really created a lot of problems also socially and mentally. So there are multiple sort of things, including like the manner in which neuroarchitecture or this entire new idea of understanding the brain interface and how it actually reacts to space is something which is also very, very interesting indeed. For instance, like we recently also did some experiments also with electrodermal activity sensors and trying to understand also with EEG sensors how brain actually perceives space. What are the stressors that it actually starts identifying? And on the other side that you see, like we've also done a lot of experiments connected with, let's say in this case, this is about spatial perception and how space is actually witnessed through computational modes of understanding and actually generating space itself so that we understand the manner in which space is structured. I think, yeah, my 7 minutes are almost up. So, I mean, but I would also like to end with this particular slide in which, I mean, I'm also looking at this very important sort of term called bidirectional communication. It is really critical that we understand, we sort of start getting rid of that connotation that space is actually an object when we are the subject. We need to start understanding how this bidirectional connection between our built environment and us and our bodies actually can start generating modes of activities, mode of activation. Let's say in this case, it's an intangible medium of light, which is then connected with my body and the movements of my body, which is then activating also, let's say, it's making my motoric movements also actually much more prominent, while at the same time I'm immersed within this new media and interaction. So for me, like this is my 2 cents that I think also from the perspective of a designer and a transdisciplinary sort of innovator, I think it is really critical that we start looking back at the importance of space, which we usually take for granted, and how important it is to actually cultivate habits which make us healthy and contribute to our well-being itself. Thank you.
Thank you so much, Nimish, for this very interesting initial presentation. Let me go to Simona Agger. She's a member of the Council of Healthcare Without Harm, Europe, and also a member of the board of the European Health Property Network. Simona, the floor is yours. You need to unmute yourself, please.
Do you hear me now?
Perfect.
Yes. Okay. I think that I will have an approach, even if I am a planner and an architect, quite different. In the same time, I think that it will be more realistic, but also more philosophical. Let's see. I start with an assumption. Pandemic is equal to a need for change. Also, the climate change had already opened a bit our eyes, but now with the pandemic, we see that we cannot avoid to make changes, but it's not easy. So we have, in one hand, we had the shortfall of the urban environment. You know, at least in Europe, in the first months of the pandemic, the 95% of the cases were in cities. On the other end, we have another very evident aspect, the inadequacy of models of care. So now, how do we try to take advantage of these both needs? Well, first of all, I am an architect, and now I'm working with a lot of medical doctors, and I'm learning a lot. One thing that I learned is that medicine, the doctors say, not the architects, covers something like 15–25% of the need of person care during his lifetime. It's not a lot. I was expecting much more. So many scientists stress the fact that a very big part of the medicine should be addressed to prevention. So we know that a large portion, if we take away the 15–25% that's covered by medicine, a large portion is covered by the well-being that comes from the famous health determinants of persons. And we know very well that a good part of that comes from the urban environment. We have another aspect that is very important. The urbanization is growing. In Europe, in the last 50 years, we went to, from 52 about urbanized people 50 years ago. Now we are to an average of 72, and in certain nations like Italy and Holland, we are up already to 80%. But the expectation is that by 2050, the urbanized European will be 90%. On the other end, that doesn't happen only in Europe, because the expectation is that by 2050, the almost 10 billion inhabitants of this planet, around 64–70% will be urbanized. So that tells us that it is really imperative to do something about the urban areas. The friend that preceded me told us, Nimish, do I pronounce correctly? Told us some of the problems of the urban areas. Yes, the urban areas of our times are in the large part not good places to live. If you look at the example, there was a very nice picture from the space of the European Space Agency that was showing how was the area, the most polluted area of Europe in 2019. And in 2020, you have exactly the same area with the worst areas of COVID. That tells us something. Furthermore, there are many, let's say, problems that come from old times parameters, old times ways of seeing both the city and healthcare. I give you an example. The urban areas were conceived and developed after the war by rationalism, by the measurement of cubic meters, square meters, etc., and worst of all, zoning. You must remember the Charter of Athens of Le Corbusier that was dividing the urban areas in 4 places for working, for living, for resting, for having leisure time, and industry. So all these ways of looking at the city don't hold anymore. Not only to look at the city, we need new parameters to understand our societies. The mechanicism, the linear element, the linear collections don't hold anymore. They were for centuries, they were our parameters, but now we have to understand that we live in a world which is super connected. And in a world super connected, you need other ways of understanding reality. You know that there is no more valid our old parameters of a cause and an effect. We now know something different. What is this something different? First of all, we have reached the understanding that One Health is our basic stone. We have needed the understanding that health is the most important factor, not only, but health doesn't mean only the health of us human beings, but the health of the animal world as well as the total environment. We have to go towards what one of my colleagues and friends started to say, and we need an ecology of health. So this ecology of health is what puts together the healthcare system and the city organization and planning. And I was speaking of prevention before. I once, in one of my articles published by Health Management, I said that the city should be the gym of health. And on the other hand, we need a review of the kind of a prevention that healthcare does. What is the prevention of healthcare? They make the diagnosis and they they make the care. This is no more sufficient. I give you an example. Children come to hospitals because they have asthma problems, they have respiratory problems. The hospital repairs them and they send them home. But they send them home and they get sick again because they have a poor urban setting, they have poor housing. But if you go to speak with a general manager of an hospital, he says, no, it's not my problem. This is not, I give you a personal example. I was the the project manager of a very, very good, I think, because it's still a sort of benchmark, European project that was called RES Hospitals. And it was a study of how the renewable energies should be considered that enter in the hospitals. This was quite a bit of time ago. We took a survey of health managers of hospitals of 8 European nations. We didn't have Portugal, but we had Spain. We had, for example, Poland. We had Italy, England, etc. 8 nations. The result was probably not surprising. The large majority of the project managers were saying in this interview that energy was not a problem. The major problem for them were the cost of the medical staff and the employees in general and the medicines. Energy was not part of their mission. So now I suppose that with the time going, at least they start to understand that there is also that problem, and that problem influences very much the way you deliver the care. Because coming back to the way of thinking of prevention, I'm speaking too much, of prevention, if you start to think that cancer is produced by so many or influenced by so many environmental problems, you start to understand that there are co-benefits. This is an important word that the WHO put out in the document of 2014, co-benefits. So you have to start to look, if you are inside of the healthcare environment, we have to start to think in terms of co-benefits. As well as the city. Am I finished with my time?
Yeah. Thank you so much for the. No, you have the time to discuss it afterwards. But thank you so much for your inspiring points. And actually, just to remember our audience, well, we know that health depends, or healthcare only influences 20% of our health. So at least 40% will be socioeconomic factors, 10% physical environment, and 30% health behavior. So actually what we are discussing here is health in a broader view, and not only in the view of healthcare. And that's very important, all the topics that you and Nimish were raising. Let me just introduce, before we start and if we're having time for our discussion, let me introduce you Nino Giguashvili. She's the research manager on healthcare and life sciences at IDC Health Insights Europe. And she's going to talk a little bit about the next normal of healthy cities. Nino, it's a pleasure to have you with us. And the floor is yours.
Thank you very much. It's my great pleasure to be part of this amazing discussion, and exactly speaking about the broader view of healthcare, and reflecting also on what Simona said, that we have no more excuses, that we need to change something, and we need to be better prepared for the future. So I would like to reflect on some of these points, and also look at the evolution of cities that Nimish also talked about, but from a slightly different perspective. And let me start by saying here that we've been talking about bringing hospitals outside of the four walls and bringing care closer to patient homes and communities for so many years now. And despite greatest developments in IoT technologies, wearable sensors and telehealth systems, the progress has been very slow so far. And now with the emergence of the new coronavirus, the pandemic has literally forced us, right, to move to the home-based care models. And now so many homes around the world have become true extensions, really, of hospitals in a way that we would probably have never imagined before, with healthcare professionals and healthcare authorities making every possible effort to avoid hospitalizations and leverage various technologies and virtual care tools to discharge patients as early as possible and manage them at home. And here we've all seen that data and technology came to the rescue, really, whether by enabling remote collection of data, remote monitoring and virtual care, or the exchange of data to support orchestration of resources and effective collaboration between various agencies, right? And I must say, from my very personal view, that it's a bit disappointing that only very few systems in the world were well prepared in terms of their digital maturity to face this shift and this challenge. In fact, the preparedness of information systems and digital infrastructure has been exactly one of the key success factors in epidemic response during this pandemic. And we at IDC have some data actually to support this statement. And I won't go into those details right now, but Just to say that a lot of research, including ours, shows that data and technology has huge potential to support healthy cities and enable the resilience of health systems actually beyond health emergencies by supporting all sides of the sense, predict, and response services model that I'm going to share right now. Bear with me for just 1 second. So if you can you see my screen?
Yes, it is perfect.
Yeah, thank you. So the technology has shown huge potential to be able to support continuous whether the part of early sensing and early detection of diseases, to support the continuous monitoring activities, to detect emerging health threats, or to support proactive systems of insights and to prevent unwanted events, or to enable effective crisis response strategies and to support ongoing day-to-day efforts to protect the health of citizens and the patients. And in all this in all these efforts, of course, data plays a key role, and COVID-19 has definitely demonstrated more than ever the value of data. But this pandemic has also highlighted the gaps and signified the urgent need for developing the capabilities for intelligent use of data, right? So we all know that the availability of health relevant data today is not really an issue. An envelope of data is available from all sorts of various sources, providing information on patient biometrics, various social determinants of health that the other speakers have already mentioned. And many other types of information, including that can be of great help, including geolocation systems to track and analyze, for example, viral spread patterns. But the key here is to develop the capabilities to move from data-rich to data-driven, and from the system of pure records to the one that can generate proactive and actionable insights to inform effective public health systems, right? And this requires developing systems for early sensing and building intelligent capabilities that will help us utilize data from multiple sources in order to spot the earliest, even most subtle changes of emerging threats, especially for those threats that are epidemic prone, like the current coronavirus, but even beyond, of course. So but earlier example, back in the early days of the pandemic, for example, a Canadian health tech startup, Blue Dot, used natural language processing and machine learning to analyze data from all sorts of sources, including official public health reports, social media, airlines data, population demographics, and it spotted the cases of unusual pneumonia in China quite a few days before the World Health Organization actually declared the pandemic. So the importance of the technology and analytic systems in early detection of threats is definitely not questionable. However, even beyond that, beyond the system of insights that we see on this simplified slide, I would say, is that this pandemic has signified the critical importance of wider scale collaboration and engagement with the broader ecosystem of all stakeholders that also includes citizens and patients. And to do this, authorities and national and local governments must really build digital ecosystems that can effectively support this kind of system of engagement and multi-stakeholder collaboration, right? And in this regard, enabling data standardization and interoperability and utilizing digital technologies such as cloud-based collaboration platforms is really essential. And, you know, the city governments are also in the best position to engage with the citizens and patients. And take advantage of their reach and proximity to leverage and leverage various digital communication channels, for example, for effective risk communication, to build much needed trust with citizens and to deliver the critical messages, educate and empower them, and to maximize the effectiveness of the health communication and promotion programs. And also they are the one closest to the grassroots, right? To the actual sources of those valuable data that are most representative and relevant to the context in which they're going to be used. So just to conclude briefly, I do believe that there are a lot of lessons that cities must and can and must learn on the applications of data and technology to evolve from the system of pure records to the system of engagements that enables the integrated sense predict enabled services model, which looks beyond emergency preparedness and enables the resilience for the next normal, and to build the capabilities for broader management and control of diseases, that we prevent what is preventable and prepare for what is imminent, and sustainably protect the health of citizens. This certainly includes not only infectious diseases, but definitely the control of non-communicable diseases, especially now that we should be preparing for what we sometimes call the next pandemic of mental health crisis and chronic diseases that have been disrupted due to severe disruptions in lifestyles and chronic care services during the pandemic. I will leave it that for now, and back to you. Thank you.
Thank you so much, Nino, for your approach on this importance of data. Let me just move to Diane Whitehouse. She's the principal eHealth policy consultant at the European Health Telematics Association. And the floor is yours. And she's, I think, talking from Brussels. Well, nowadays we never know. You are muted, Diane, sorry.
I am. Hello, everybody. Great to be with you, Alexandre and colleagues. In fact, I'm speaking to you from a location that has the privilege to be called the food capital of Yorkshire, which is a small location in the north of England.
Better than Brussels. Better than Brussels.
Well, Brussels is a wonderful city, a very green city, and it's one of the more habitable ones, I would say, in reality. So let me start by saying, as Alexandre and Nimish have said, we really are facing at least two major challenges in the world today. COVID-19 and its variants, and environmental, ecological threats. As the futurist Richard Hauser said, this could really be almost the last chance, but the best to take action. And therefore, largely because I'm sat in this wonderful small village at the present moment in time, I thought it a good moment to start from the work that Norberto Patrignani, ethicist and computer scientist from Italy, and myself cooperated on, which really focused on the benefits of slow tech, and slow as in slow food and the opposite of fast food, meaning food and hence technology that is good, that is clean, and that is fair. So really focusing on those ethical issues that Simona was emphasizing for us around equitability, around cleanliness, and around environmentalism, and around everything that is good and beneficial. Health and good health is certainly to our benefit, and equally in very habitable cities like the beautiful city of Coimbra with its 150 100,000 inhabitants or so, rather than the megacities to which we were introduced of 10+ million and 20+ million, the largest three of which are in China. And I know that we're joined today by people from many different continents and many different locations, not just European. So health is important to all of us, whether we live in a megacity or a small city, whether we live in a town or a village or whatever our community is. And equally, it's important to those people who live in very isolated areas, small islands, lengthy distances from others. This is why in EHTEL, we've been exploring more and more the notion of hybrid care, which others occasionally call blended care, and really as a new strategy for bringing people with their healthcare professionals and providers and with their carers, a mix of face-to-face, but also physical. It is one of the areas that we emphasize, that we've done a lot of work on, that we have webinars on. And this kind of physicality brought together with virtuality, virtual encounters, has really arrived on the scene, as Nino emphasized, during the COVID-19 pandemic. As our own president, Donna Henderson, tends to say, but it's not just about having hybrid care, it's now making it stick, doing things, being active to help it stay with us. And based on its utility, on its benefit, we've produced a number of pamphlets, brochures. I would say I'm not one of your authors, actually, in Health in the City, in the Healthy Cities issue. So it really is a privilege to have somehow snuck on board and joined you. But we have produced, for example, brochures about hospitalization at home, and our EHTEL members, whether in Netherlands, whether in Belgium, whether in other parts of Northwest Europe, are very interested in this particular area. I wanted to draw on the video consulting services that in particular colleagues in Wales under the leadership of the Welsh government have been working on at the moment. And afterwards I will provide Alexandre and colleagues with useful URLs to which we can go. They've really come on board fast in a very agile way, as many other leading regions and cities did during the first 18 months of the pandemic. And I think that agility is something that we can perhaps explore with Nino in particular, in terms of what did it take to then develop these services very rapidly. When they were doing their comprehensive evaluations, they were really seeing that some 80–90% of the people who replied were telling them that yes, it was not only about the benefits of time saved, but it was about the pluses of not having to travel, of not being involved in transportation, and not having to find parking spaces, for example, or the practicalities of these things. There were also very high figures for the benefits that came from video consulting, being able to attend a consultation or an appointment with your family members, whether you're a parent or whether you're a child, vice versa. And overall, absolutely about the environmental benefits that they were seeing, those who were thinking about CO2 reduction, for example, and the improvement, as Simona told us, in smart hospitals, of the efficient and effective use of space. So I think in terms of building smart cities, which is part of today's title, it's not just about building smart cities, but it's really about, one, building smart buildings, but it's also thinking about the long embedded built environment. Today I'm in a building that it's about 250 years old, I think, as a guesstimate. So it's also about converting buildings, converting homes, converting offices, and so on and so forth. Last but not least, therefore, in terms of how we use data, again, which is a wonderful linkage with Nino's piece, we ourselves will be coming back to that at the end of November, 30th of November, 1st of December, in our Imagining a Citizen-Centric Health Data Ecosystem Thought Leadership Symposium. And that's really where we'll be placing our emphasis in this end of this year and throughout 2022. So all welcome to join us. We would love to have you there. Thank you all very much indeed, and looking forward to our next speaker.
Thank you, Diane. Thank you so much. Let me just move to Raju Narayan. He's a senior health care specialist at International Finance Corporation, part of the World Bank Group, and he's going to talk you transforming healthcare. Raju, the floor is yours.
Thank you, Andrea. I'm just going to try and talk a bit on the practical aspects of healthcare delivery models, how it has evolved and how the pandemic has accelerated some of that evolution. Let's say, 20 years back when we were building a hospital in Asia, we were thinking of coming up with a quality policy for the hospital, which can resonate with the provider as well as the patient in terms of what is that the provider want to offer and what the patients are going to be expecting out of that provider. And we want to keep it something simple, but at the same time, covering the entire ecosystem of healthcare delivery. So we want to keep it as simple as the ABCD of healthcare. So this is what we came up with. So if you look at it from a provider point of view or from a patient point of view, what do they want? So the provider want to assure the best outcome, which is your clinical outcomes, and build seamless operations that processes are seamless, so the patient goes from one point to another seamlessly, and create value. The patient would expect value for the money they are spending in getting that healthcare provision. And of course, the last one is about the experience, which is very important, because sometimes in a healthcare setting, you can't guarantee the outcome, but I'm sure you can always guarantee the experience. That's still within your control to make sure the patient goes through a good experience. Doesn't matter whether you are going for a life-threatening condition or a simple health screening. The experience matters a lot to the patient. So that is a D, which is delight with personalized care. So these fundamentals have not changed 20 years from then. Even if I look at it today across the globe, these fundamentals have not changed at all. But what has changed is how do you deliver that care? The delivery model has evolved over the years. So if you look at the global healthcare trends driven by various factors, whether you look at the demand drivers or the supply gap, so you see many things here, whether it's quality or changing population, the accessibility of healthcare, and of course we will come to the COVID impact later. But changing disease profiles, all these are the demand drivers that kind of contribute to the healthcare delivery. And then on the other side, you have your supply gap, which talks about whether it's private versus public sector, different pricing models, and someone talked about data, so the importance of data in healthcare. And there's another huge challenge of healthcare professional shortage. That's again a supply gap that drives how we want to deliver care. So now, if you look at pre-COVID, what we could see is that the healthcare delivery was very much fragmented. It is still fragmented in many parts of the world. So you had a very fragmented primary care, a nearly non-existent secondary care. In many countries, you go from primary care straight away to tertiary care. There's nothing in between. So that was non-existent. And then the tertiary care or the advanced care was very much hospital-based, very much focused just at the hospital. That means you need to get to a hospital to get care. So that is one of the aspect of how it was before COVID. And when you look at operations, a lot of silos operations. Everybody works independently, not much connectivity there. And they were always isolated pockets of excellence in the healthcare delivery model, but not in a connected way. You look at technology, there was limited use of technology as an enabler to bring accessibility to private healthcare or early detection, or to even address the shortage of healthcare professionals. Technology was not very heavily used. And then the last one is talking about, in many countries, it was public sector versus private sector, not a cooperative or a collaborative approach. So this was how healthcare was and is in many parts of the world. So now, if you look at what has COVID done, is it has really disrupted the demand. It put every healthcare system to a stress test to see who survives and who doesn't survive. So it's really disrupted the demand for healthcare. Government intervention. The many governments have realized that they can't do it alone. Definitely, you need to cooperate and collaborate with the private sector. Supply chain disruption was a huge impact of COVID-19. Many things were taken for granted. People really didn't, pay a lot of attention to how a particular consumable or an item gets to your doorstep from the manufacturer. So the supply chain disruption was a huge impact, and of course, the economic implications. So when you look at the COVID, the opportunities and challenges that has happened is that many things have changed. So increased focus on quality outcomes, care delivery within a system, not just based on just one particular hospital or an infrastructure alone, and increased focus on cost oversight and efficiency and data planning. We talked about that, and partnership models between public and private or with various stakeholders, and the care system that is going to the patient rather than the patient going to the care provider. So that's one of the huge impact of COVID, and an integrated model. So this is the key takeaway from the COVID impact, is that it is not just hospital, it is between the primary care, secondary care, and the hospital, the integrated care delivery model. So the patient is treated at the right level, the right siting of the patient care. Because in COVID, you realize that for many things, you don't really need to go into a hospital. You could get treated outside the hospital. So many systems that survived the COVID impact were those systems where they had actually decentralized the care, but then integrated through technology or other means. So, if you have a dental appointment, you don't really need to go into a hospital to get a dental treatment. You could actually get it done in a dental clinic or an extension of the hospital where you have the dental services outside the hospital, and you couldn't get it treated. But then, so that is decentralizing, but then you integrate it together with technology. So a true hub and spoke model. So that is what COVID has really opened our eyes to. And of course, the most important thing about digital health, we talked a lot about that, how digital health has become an enabler to integrate all these decentralized services, out of hospital services. And digital health can do much more than that. It spans across the entire healthcare delivery system, manage volume and the data, how the patient is being treated, what kind of information you collect through digital health. And the journey starts not when the patient reaches the hospital, even beyond that, when the patient starts thinking about healthcare needs, the patient information, digital health plays a lot of part in providing the right information to the patient, and post-operative, post-hospital care, when the patient goes back to their home, how digital health being again enabler to keep them engaged with the healthcare delivery, preventive health, and healthy living rather than illness treatment. So digital health plays a huge part in that. So just to summarize it, if you look at it, what COVID has taught is that no healthcare system has got it right. Nobody is perfect. It's all about strengthening the healthcare system, removing silos and improving coordination and promoting value to the patient, and increase opportunity for decentralized or out of hospital services and integrating them back with technology to make healthcare accessible, affordable, and appropriate to the patient. And the other huge change which we are seeing in many parts of the world across the globe is increased focus and attention to building trust, because when you are in a crisis situation, that's when you are most vulnerable, and that's when you look for trust between your provider and your patient and the different stakeholders. So there's a lot of attention on trust through ethical practices. So a lot of attention we see across the globe in many organizations doing that. And of course, the quality of care, how, a lot of focus on providing quality accreditations and improving your infection control. And so such things also play a huge part in from the COVID, which we learned. So I will just pause here and hopefully we have some time for some discussion. Thank you.
No, thank you so much, Raju. I also invite all the participants to use our Q&A box where you can put your questions. I see that we have broader participation from Buenos Aires to Ethiopia to Australia. So it's a very, very broad and global audience. Let me just start the hostilities. And please feel free to answer to this or to comment. What is the real risk to go back to business as usual and to waste another good crisis? Because mostly we had, well, this century, we had several crises, financial and fiscal sector crisis, other crises. What is the risk really to not work on this issue about health and smart cities, smart buildings, and business as usual? Who wants to start? Diane. Yeah.
Hopefully you can hear me. I would just say, I don't think there is really a choice at the present moment. It's not about going in reverse. The crisis, but the crises are far too pressing to allow us to not go forward. And besides, as a Greek philosopher once said, you never step in the same river twice. Ultimately, you know, we learn, we're human beings, we're going forward. Let's not go back.
You are optimistic. Nimish, are you so optimistic?
Well, for me, I think prevention is better than cure, right? I think we have already learned a lot from our past mistakes. And actually, the fundamental problem has always been to think in a very siloed manner. This has been like the bane, and I think it's almost in every discipline, actually, you see this particular thing happening. But for me, I mean, I think apart from, let's say, the digital bit, I think it's the physical environment which really needs to be rethought. It's really critical because these things will directly or indirectly come and impact you, no matter what you do, no matter what you say. So like climate emergencies are already creating havoc. So it is impossible to actually say, like, even if we let's say make a very robust digital infrastructure, the underlying essence of, let's say, what we are doing to our natural ecosystems, how we're destroying this, is actually going to directly impact us. And it's only going to be creating more data and more data in terms of, okay, what are the comorbidities that are actually occurring because of this. So I think it's really high time that we start thinking in conjunction, start thinking in terms of relationalities, and therefore think about shaping our built environment and health together.
Raju?
Yeah, I think it's going to be a new normal, because I don't think it's, you know, you're going back to pre-COVID. People talk about going back to pre-COVID, but I don't think that world exists anymore. So it's going to be a new normal because we have learned better ways of doing things out of necessity. So it will be a pity to go back to pre-COVID. So I think we should learn from that and then move on. So it's not going to be, so again, back to my healthcare delivery example. So it's not going to be brick and mortar kind of healthcare alone. And it won't be just clicks alone. So it's not bricks or clicks. It's going to be an integrated and hybrid fashion of how healthcare is going to be delivered, how it's going to be received and received. Thank you.
Let me just introduce you some data. You have seen now, for example, in the United States, the claims for Medicare for telemedicine appointments. They are equal as pre-COVID now. When they increased during the pandemic, now they are equal to pre-COVID times. Or other issues regarding, for example, even in another topic, the social disparities increased a lot during this COVID. Are we doing something when we are talking about housing, workplace? Are we improving and moving forward? Simona, you are muted, sorry.
Yes, I wanted to point out the fact that we should go back to the city, which is the main subject, I suppose, of our webinar. Okay, going back to the city, I think that the major lesson we have to learn to answer to your point, if we don't want to go back in the old shoes, as I say, is to learn that the city is a system. You cannot do what you were doing before. You make a transportation plan, you make a bit of plan, you make, and things don't work. Look, I'll give you an example, a very simple example. The problem of reopening schools is not only European, it's all over the world. So where were the first attempts to reopen schools? To improve the inside of a school. You change the seats, you move them, you enlarge them, you put wheels so the students can be a little more apart from each other. It was a total failure. How many schools opened and closed again? All over the world. Now, at least in my small country, they have learned a little lesson. So then now they start to think in terms of transportation of the students, inside of the student of the schools. There are other parameters, and they take care very much of the health of the teachers. They look into the families. So is a sort of more systemic approach that quite probably will bring some results. On the other hand, the total city has to be conceived like a new system. We know very well we will not have healthy cities until we have ghettos. We will not have healthy cities until we don't have the right ratio of not only of green, but now we say also of water. But the solution is not the solution of making the urban trees, the urban buildings that look like trees, or to speak of the urban forest. These are, first of all, there are buildings only for rich people because they are very expensive to make and to maintain, and probably not even so healthy. But second, we then don't have to mimic the forest. We have to produce cities. I had a fantastic example to show to you, which is the example of Freiburg, or Freiburg, as you want to pronounce, in Germany. If you want to see an ecological utopia that has become true, start to study that example. And you will understand, we will not have healthy cities if we don't have a systemic view of the city, which is very far from. I'm sort of skeptical for that, and on the other end, because we will not have good cities until we have good participation of the people.
So mostly you are talking about the new governance model for managing the city, to developing the city. And that's not there at all at this point.
Yeah.
Nino, yeah. So Nino, how can dates support this participation and engagement of the population?
Yeah, right. Data can support this in all sorts of ways. But before I respond to that, I really wanted to reflect to what Diane started with, is about that we don't have a way back. I believe there is no way back, at least in many aspects. For example, the telehealth and remote monitoring systems and home-based care model, they're absolutely set to go forward, and there is no back there. There is no way back there. And in terms of the lessons learned, listening to all this amazing discussion, it seems to me that the main lesson should be that we should learn the lessons, and we should learn that that the data alone is not enough. The data must be collected, managed, and used in an intelligent manner in the context, in a relevant way to the context that it's going to be used, and in a very proactive and intelligent way, and to innovate. This may not sound very innovative, but for example, some time ago, the Madrid government tried to use the contaminants from the coronavirus as an early detector to detect the spread and to track the spread of the coronavirus. Well, that might not be the best indication, for example, but at least it's under investigation. It may be a very good method to assess the spread patterns, for example, and then design the respective response strategies. And of course, one other lesson that we mentioned already during this discussion is to support multi-stakeholder collaboration between governments and private sector, and to also engage healthcare professionals and patients and citizens in this discussion and in this effort.
Thank you, Nino. Let me just go back to our Q&A box. Pedro Pires is asking, also he's giving the example of disruption in the finance sector as all the fintech that are appearing and changing the market. And he says mostly, or his point is that only with this kind of new players you can have this acceleration of change. Are you seeing this on development of healthy cities? Some disruption or new players that are accelerating the change? Who wants to answer to this? That's a very good point. Is someone moving this change, accelerating this change? Nimish, do you want to start?
Well, yeah, I think in many ways, actually, it depends, like whom are you talking about? I'm literally looking at big organizations who are actually making this change. But let's say even movements like carbon sequestering is actually now becoming big, including experimentations in cool roofs is actually becoming a big thing right now. But actually some discoveries are even more interesting in terms of solar panels. But solar panels with an embedded layer of actually urban green is something which enhances the potential of solar energy production itself. I mean, that itself was a big interesting finding also, which is conducted by the university sector. So, I mean, I think, let's say my interest has always circulated around even these small bits and pieces that can actually start impacting the manner in which, like even in interaction design, actually, it's very interesting. There were ways in which you adopt a tree, but from the perspective that sensors are also giving back to you in terms of, well, how much oxygen am I producing, or what is my current state right now? And therefore, this nourishing attribute that you actually develop between, let's say, a person who adopts something. I think this is something, these are like very simple, like things which actually impact us at a human level. I think those are the key to start making a difference, including in the hospital and actually the in-home care sector. I remember in Holland when I was actually interacting with Philips once, they were talking about their entire digital suite in terms of data exchange, etc. And I was talking from a very different perspective. I was saying, Well, the patient's room where the patient is actually not only a place where medical care is given, it's also a place where he entertains his family. It's also a place where he actually has intense conversations. So why doesn't this space actually also have a different outlook from clinical to something which actually transits in its emotional sort of content as well in terms of its ability? So I think there are multiple things that still need to be considered, and as from a design perspective, also from this notion of interconnection between space and architecture and health itself, I think these would become very viable issues definitely in the future.
Let me introduce a new topic. Mostly during all this crisis, remote work was probably one of the biggest developments. And we know that since the Industrial Revolution, population moved to cities to find a place to work. They actually previously they lived where they worked also at exactly the same place. And we started to develop these mega cities with this idea of getting employment and from rural areas to urban areas. Are we going to see a change in the way the cities is now this urbanization will be? Or are we going to see a change to rural areas or a movement to rural areas due to this increase of remote work? And what would be the impact on the health of the population?
Well, I can only talk in terms of what's happening in Australia. This is already, you can see this movement actually from the city to the rural. And therefore, like a huge economic imbalance as well, which is happening in the process. Like real estate is shooting up in rural areas. Affordances are actually going to the dogs because people who were living there are no longer able to live there. So there's a massive upheaval in terms of what is happening with the whole demographic shift. At the same time, what's happening with, let's say, the people who would normally sort of migrate to Australia, how that stop actually, which has been put because of COVID, that is also starting to impact the economy and the job sector as well. So there are multiple issues which are, again, like I said, it's all interrelated. It's like we have to understand this whole chain in order to understand, well, what is going to be the ultimate impact. But sorry, I think Diane wanted to say something.
Diane,
yeah. There's definitely a move away from cities to rural areas. That's definitely a trend that's being seen in Europe, at least for those who can afford to do so. Because at least let us understand that much of the work that needs to be done and is done is actually physical work that is done in very central areas and very urban areas. So there's a limitation about how much people really can move and move away. There's also a move towards what's called gentle density, I think, in urban areas. Yeah, let's say the reform of brownfield sites. So that's another option. But to bring the conversation back to your previous question, I think some of the exciting things that we're actually seeing.
So please go on, Diane.
Yeah, some of the things that we're seeing are actually really about interesting work in large hospitals, smart hospitals, and their interrelationship with smaller polyclinics, local community practices. So there's actually a fairly massive shift that's happening there, I think, at diverse levels. But I saw Simona kind of puzzled or despairing, so maybe you have a very different view, Simona.
Please unmute, Simona. Please unmute. Sorry.
I always forget something. So
it's not a Zoom session without the mute.
I'm not systemic enough. Okay, so yes, I have a bit different point of view under two aspects. First of all, the data that I know don't show very much the going to rural, and in fact, if even after the COVID, they are projecting. This is the European Bank of Investment, that projects an increase in urbanization. But on the other hand, the new rural is a sort of mini urban at the very end, because I would consider it a real ruralization if people would go back to make the old agricultural work, but they go back to stick at their computer and to be connected in internet, and the style of life, let's say the request from life doesn't change very much at this point. So it's pseudo-rural, in my point of view. So again, I would like to back to the urban environment. I really would like. And at this point of view, I was in a webinar a few days ago, and they were asking me, because I was the only urban planner, if I would consider that the smart work or call it what you want, homework, would decrease the sprawl of the city. I answered, in my point of view, no. Because, excuse me, I didn't say no. I said it would not be a very relevant aspect in the sprawl of the city. The sprawl of the city has to be controlled in many other ways. And because if you look at it in a systemic way, if you start to make the so-called remote work, or you kill the women, or at least in a situation like Italy, you are obliged to intervene with different standards of living. And that requires more space. So back to Diana, I disagree a bit with her in her definition of rural. And even in the way of data, I don't see very much this move towards rural. So also for the smart work, I think that we need to control the use of the land. We need to rethink of our cities also in those terms, which means also to recuperate many sites that are contaminated, and they should not be. But I think that the urbanization is a fact, and we have to take the best of this fact. And probably the real change will come from that.
Thank you so much, Simona. I will ask you just, and we are over our time, I will ask a final take-home message from each of you. Maybe I will start with, we start with the order that we done the initial presentations, and I will start with Nimish, please. Final messages.
Final message will be to become a little bit more transdisciplinary in a sense. Start thinking about the interconnection between various fields and the implications that it would have directly or indirectly on urban health.
Nino? Simona, so you are Nino, please.
My final is that I would recommend to all of you to explore the meaning of One Health concept, because it's really a sort of a container of change if we use it properly.
Thank you, Simona. Nino?
I would say the main message would be to really move from data rich to data driven. And this may sound a bit pragmatic, but it's really, really very important.
No, thank you so much, Nino. Raju? Oh, sorry, it was Diane. Diane, please.
I'm never sure whether you can hear me. However, hybrid and blended is the destiny of our exploration.
No, thank you so much, Diane. Raju?
Yeah, I think take-home message would be not to look at healthcare in silos, but as a comprehensive, connected care model focusing on accessibility, affordability, and the appropriateness of healthcare delivery. Thank you.
So thank you so much for giving me the opportunity to moderate this amazing session. I will take the opportunity to visit Freiburg, I believe, and all the ones that are participating. I think that's the final and good recommendations. Let me take some sentences. Actually, we have on our chat. The new rural is the new mini urban, and there are other ones. We need an ecology of health. Cities should be the gym of health. So many good insights. And take home from Simona, urbanization is back. But mostly let's visit and try to use this post-COVID time to know each other better, face-to-face, and visiting all around and developing an amazing and healthy city. Thank you so much for all of you.
Thank you.
Really, thank you. You were a very good moderator.